What I'm going to be discussing today is the treatment and diagnosis of specifically protozoal enteric pathogens. And so we're going to be discussing the importance of these organisms in your shelter environment, the organisms specifically of concern that you're most likely to find, the current research that I've been involved in, as well as your diagnostic options and treatment options. So why are we even worried about these guys? The protozoans can be particularly contagious. They can spread. They are really some forms of the organisms. They can insist and get in the environment, and they're almost impossible to get rid of once these forms are in your environment. I mean, they're very resistant to most disinfectants, and they get into crevices and things that you just can't get into physically to remove, and they can be very, very challenging to get out of that environment. In addition, they're very difficult to treat frequently in your patients. It's hard to get, there's not a lot of drugs that really are effective, or if they are, they sometimes have adverse side effects, and so they can be very challenging to treat on the patient level as well as your environmental level. And your shelter facilities, you have limited resources. You need to be able to figure out, what's going on with your patients, what's going on with your animals in your shelter, and what's the most cost-effective and efficient way to use your resources to take care of all of these animals. Like I said, because these things infect the environment, it's easy for animals to get reinfected even after you've treated them and you've cured the problem. And it's possible that these kinds of infections may reduce your adaptability. If you have a cat that's having chronic diarrhea and it's in a group room and he's kind of a little nasty on the back end, a doctor's going to kind of come in and go, oh, I don't think I want to do that. So, and that in and of itself can be a really significant welfare issue for those cats as well. And for some of the agents that we'll be talking about, there has been a concern for the potential that these organisms may infect human beings as well. And so people are sometimes concerned that you get your volunteers sick, your staff sick, your adopters sick, if the animals in your care have these organisms that they can also, the humans can get infected by. Specifically, the organisms we're going to talk about today that are concerned in a shelter environment are Cystoisospora species for both dogs and cats, Giardia lamblia for both dogs and cats, and I'll go into more specific details specifically with each of these organisms as we talk about them. But I just kind of want an overview. I mean, you have three that are of a concern in both dogs and cats, like I said, and also the CRYPTOSPORIDIUM. And then sort of an emerging contagion is Trichomonas fetus in cats. We've discovered this several years ago, and we're still kind of doing a lot of research to find out what is the best way to deal with this organism, because once it's another one of those ones that's there, it's kind of hard to get rid of. So my current research project was to determine the prevalence and risk factors for different enteropathogens in cats in different types of management models for unowned, free-roaming stray cats. And what we hypothesized was that cats that would be in group housing settings would probably be more likely to be infected with these agents that have a higher prevalence compared to singly housed cats. And then we also were thinking that animals with diarrhea would be more likely to be infected than those that had normal feces. So we did a cross-sectional design to investigate if all of these suppositions were true. We selected multiple agencies under each model, and for those of you that visited the posters last night, you got kind of a preview of that. We have a traditional shelter, which has the cats are singly housed. Those are primarily short-term facilities. Cats are there for 7 days to maybe a month. Those that were included in our study were 7 days to 21 days. The sanctuary type of housing is it's kind of intended for cats to live out the rest of their lives in these kinds of facilities. The cats that were included in our study had been at those facilities for at least 6 months, most of them much longer. And so that's kind of the inclusion criteria for the key that we selected for those organizations. For foster care, we selected networks that took cats directly from the public rather than taking them from a shelter or a sanctuary or any of the other models. We wanted to kind of not have that cloud our view. So, certainly some agencies will take them from these other agencies, some foster networks will take from other agencies, but the cats that we included in the study could not have come from those before going to the shelter. They had to go into the foster network. They had to be directly from the public. And these could be group housed, they could be individually housed. It was kind of a mixture. There may have been resident pets there as well. These cats were generally in these facilities for up to 6 months is how we included them in our criteria. And then for the free roaming cats, we selected cats that were brought to a TNR, trap, neuter, return clinic to collect samples from them. So it's possible that we may have some friendly ferals in there, if you will, but primarily the idea was we're talking about cats that are out in the environment, that are free roaming, that's primarily where their exposure is going to be. We collect samples from these animals, either from litter boxes, from traps, or from the anesthetized free roaming cats, and then tested them for multiple different organisms. So by PCR, we tested for CRYPTOSPORIDIUM, Giardia, the Trichomonas and Toxoplasma, and then the coccidia we discovered primarily from fecal flotation, and then other agents we looked for as well, but that's not the point of what we're discussing today, just the protozoals. And this was done by real-time PCR as well as zinc centrifugation flotation. So as I mentioned, these are the different models that we talked about. The shelter kitties that are by themselves and in single housing units. The sanctuary cats that usually live out their lives in their new home with the rest of the cats that they're living with. The foster care and the TNR. So Cystoisospora, most people are more familiar with this being called coccidia. It had previously been known as simply Isospora species. And so what we found in the study with our kitties here, what was kind of interesting, so half the samples that we took from all of the cats were symptomatic, they were diarrhea, and the other half were normal feces. So that's what you're seeing here. So the blue is samples that were normal feces, and the red are samples that were diarrhea. And what was interesting is that we found that while we found Cystoisospora in every management model, it was statistically more significant, believe it or not, in the shelter cats that had normal stools. So this is concerning, right? Because we need to know if animals are coming into the shelter, if they're asymptomatic and they're shedding something that could potentially contaminate the environment, that's concerning. So this is one of the good things that we're finding from this kind of research. Like, oh, okay, we didn't know that a lot of these asymptomatic cats are carrying something. We need to maybe think about doing something about that. And we'll get to that in a minute, but I want to talk about the rest of the research. For the Giardia, we found that the sanctuary cats were more likely to test positive if they had diarrhea compared to those that had normal feces. And then we also found that they were more likely than shelter cats to be positive for the Giardia as well. And then finally, for Trichomonas vitis, it was just amazing to see the prevalence in just the sanctuary cats alone. And what was also interesting is that the ones with diarrhea were definitely more likely, almost 3 times, to test positive than those that had normal stools. So there is a little bit of index of suspicion that can be raised if you have a sanctuary cat that's having this kind of really liquid stool. You should be suspicious of this particular organism. So in summary for the research, we had multiple enteropathogens and co-infections also prevalent in all of the management models, actually. And that diarrhea wasn't always a useful indicator of whether or not an animal might be infected. The prevalence of specific enteropathogens did vary by the management model, which is probably a reflection of the different types of preventative care that are done in these kinds of different settings. Oh, as well as the housing conditions. So specifically our agent. As I said, Cystoisospora, what everybody but is pretty much comfortable with calling coccidia. These are very host-adapted species, so those that infect cats pretty much infect cats, those that infect dogs, and they don't infect people. And so how you want to diagnose these in your shelter environment, the easiest thing really is a zinc or even a regular kind of fecal float where you set it on the counter and you mix it up and you read it under the microscope. And that is able to identify the oocysts. And you can see here, these are both different Isospora species, but they're both the ones that infect cats. And this one is just simply, this one down here is just simply had its first division. And so, as I said, these are pretty host specific. You don't have to worry about your animals, your dogs getting it from the cats, or your staff getting it from the animals. The best treatment options that we have for now really is panagerol. We found that the Albon, which a lot of people have used in the past, the sulfadiazine, it just does not effectively address this particular organism. This is easier to use if it's diluted, and I'll get to that in a moment, but there's like 2 different products that are available on the market. The panagerol is what most people are familiar with. It's also called Markey Paste. It's a tube that's about yay big, and it's actually for treatment of horses. However, because it's this really thick stuff, it's easier to treat your dogs and cats if you dilute it a little bit. The dose for this is 30 to 50 milligrams per kilogram once, and then it can be repeated in 7 or 10 days. And the cost is actually, even though the tubes themselves are pretty expensive, like almost 100 or a little bit more per tube, the cost per dose is actually not that bad. Since you're diluting it out and you're just giving a small amount to each animal, it winds up being just a little over 50 cents, almost 70 cents per, like a regular sized cat. Now, Baycox is something, these 2 compounds are very similar, they're very related, and unfortunately, the Baycox is not available in the United States. However, I wanted to address it because I've had a lot of people ask me, well, this seems like it's already made up as a dilution. I don't have to dilute it. Is this something that might be cheaper? As far as the cost difference, you can see 1 dose for a normal-sized cat, it costs about the same. So there may be a convenience factor in the Baycox versus the panagerol, because the Baycox actually comes already as a 5% suspension, and so you don't have to do any dilution. However, you have to be very, very careful with this stuff, because if you get the wrong thing, they have 2 different types of dilutions available on the market, and the 2.5% is intended for birds, and it can be really, really irritating to the oral mucosa if it's given to a dog or cat orally. It can really cause ulcerations. It's nasty. So that's another caveat. If this is something that I know we have some international folks that this may be available for them, just be cautious about which product you're actually getting and using. So as I was saying about dilution, what I like to do is dilute it out to what you can dose as a 1 ml per 10 pound. Now the problem with that is it is really thick, and so you have to have it in a type of bottle that you can squeeze. But what I like to do, because it is really bitter tasting and it can make cats, especially cats, just go, this is awful, I like to put it into a syringe, a dosing syringe first, then chase it in the same syringe with some Strongid, and then do the quick shot, because then they get this taste of the Strongid first, which is a little less objectionable, and then get the rest of the panagerol at the same time, and then I know, then they do the shake thing. But I found that when I do that, they are more likely to actually swallow it than give me a big fight. So, you have these in your notes. You just dilute, to get to that concentration, you just dilute a whole tube with 31 or 21 mils of water, but it really is important that you have that in a special type of bottle, because it's really, really thick. The reason I like this is because it's 1 mil per 10 pounds tends to be the same dose that most people use for the Strongid, and so it's really easy for shelter staff to just remember, just do the same thing for everybody. However, you do need to have access to those kind of squeezy bottles. So if that's just too challenging, you can do with a 50-50 dilution. You get still a similar kind of concentration at the end, and it's a little bit more liquid, so that you can still draw it up in a regular syringe. And this is, you just do 1 mil per 5 pounds for your dosing. So it's still an easy, you can make up little charts that you can put on your treatment room for your staff to make it up by weight. And then, of course, you do want to store it in a light-proof container. Since that's the way it comes in, it will degrade if it's exposed to light. Other considerations you want to think about with this particular organism is that you want to retest, if you can, in 2 weeks after the second panaceral dose, just to make sure that it's been effective. Really clean that cage well to try to get the spores out if you can. Once this thing sporulates, it's usually about 8 to 12 hours after it's been shed in the feces, and that cyst is really, at that time, that's infective. And so if you can get the feces out of the environment immediately, or as quickly as possible, I mean, at least scoop in once a day, preferably twice a day in the litter boxes, and then, picking up after the dogs in the run, that's ideal, because if you can get that oocyst out of the environment before it sporulates, then it's not going to be infective to the other animals that are there. You can retreat with panaceral if you don't get clinical resolution with just doing the 2 doses. However, if you're having chronic diarrhea cases, which this is going to wind up being a theme here, you're going to want to start looking into what else might be causing the problem. I mean, you can start with empirical, but then if you're having symptomology and you're not getting resolution, you want to find out if there's something else going on that needs to be addressed. So this is one of the ones, Giardia lamblia, that we have some concern for zoonotic transmission, for people getting infected with this. The best way to diagnose it is through a fecal ELISA, the SNAP test. You guys are really familiar with this. It actually has a really great sensitivity and specificity, and you don't have to wait for results to come back from the lab if you send this out. It's actually about 95% sensitivity and specificity, or 99% specificity, excuse me. And if you do a fecal float, just because you want to do that kind of routinely and check, you can see this organism on those slides potentially. It's difficult to catch them through that particular method, which is why I don't use that suggested as a diagnostic tool, because you're really probably not going to catch it. But if you do see it, you may see this little guy, and he has what they call a falling leaf type of motility on the slide, and that's going to be important when we get to the tritric, because it has a different type of motility. Those 2 organisms can be really easy to mix up when you're looking at on the slide, and so if you have a swimmer, you can kind of distinguish them a little bit just by the way they're moving. But anyway, what I wanted to tell you about this guy, Lamblia is the same as duodenalis, is the same as intestinalis. The name just keeps changing over time. What's interesting with these guys is we've done more, or I should say not we specifically, but there has been more studies done on the DNA of these. And what's been determined is that, so this Giardia lamblia has different kind of subgroups. They're called assemblages. And we found that they're more host adapted than we originally thought, that the assemblage A infects humans, assemblage F infects cats, and C and D infect dogs. And there's really not as much crossover as we once believed. Now, there's still studies being done on this. I can't say that there's no risk for infection of humans, but it appears that it's not as much of a human infection risk as it was once believed to be. Still, you want to treat, because you don't want your animals to be involved or be infected with these. So the best thing to treat with is fenbendazole at 50 milligrams per kilogram orally. And you want to do once a day for 5 days. Generally, you don't need to do metronidazole with it, but if you're really having a bad symptomatic case, you can pair them or follow up with metronidazole if the case is symptoms are not resolved after the treatment with the fenbendazole. And really, the treatment goal for this is resolution of the symptoms. It's really difficult to completely get rid of this organism. You may find it again later. And so that's why when you do have resolution of your signs, it's really not helpful to try and test again. If you are still having symptoms, again, you're going to want to do some other diagnostic investigation to find out what the cause of that diarrhea is. The cysts, as I mentioned, those Giardia cysts, they do insist as well and get into the environment, and they're really difficult to get rid of as well. And so if you can just keep picking up after those critters when they go, then that's going to reduce the infection in your environment. Okay. CRYPTOSPORIDIUM, this is another one that we're concerned about with potentially being of a human infection. What you want to do for diagnosis primarily is PCR. Now, the reason I have this slide up here, this picture, I want to show you. This little thing here inside that circle, not the white circle itself, but that little thing inside that white circle, that's our CRYPTOSPORIDIUM. The larger one up there is our isospora, what we saw earlier, okay? So really doing a fecal float on these, yeah, you can, they're there, but they are so tiny and they're so hard to see that you're really unlikely to catch it. And so that's why PCR really is, if this is something that you're concerned about, this would be the way to go. Fortunately, we found out in the research we've done that at least in the study that we've performed, cystoisospora was, CRYPTOSPORIDIUM was fairly low prevalence in most of, actually in all of the 8 different management models. For treatment, there really isn't anything that's been proven to be effective, unfortunately. And so, you know, there's really no point to try and test again for this specifically. It's just one of those things that you want to have for disclosure to your adopters. You know, just have them be aware that this is a potentially, you know, lifelong infection. And but what's good is the fact that, again, people were concerned about this being a zoonotic agent. And in a study that was done with over 22,000 people, they found that when they tested the DNA of the people that were infected with CRYPTOSPORIDIUM, about 0.25% were those of CRYPTOSPORIDIUM felis, which infects cats, and only 4 of those cases, so it's, I mean, less than a portion of a percent, I mean, really very small amount, were the type that infects dogs. And so there's not really much crossover between the types that infect people and the type that infect animals. And so that's the good news with this. Again, the oocysts are infectious in the environment, and they're infectious when they shed. So that's why it's really important to get this, you know, if you know this animal has it, you definitely want to be on top of cleaning up right after them immediately. It's good to maybe segregate your new animals from the old if they're symptomatic, just to see if there's something that you need to treat before you introduce them to your group housing situation. And now Trichomonas foetus. This one is a really challenging one as well. Because it can hide, it's especially difficult to find this in cats that have normal stools. It just seems like when they have diarrhea, they're just more likely to shed it if they are infected with it. And so I discussed this with Dr. Jody Gukin at North Carolina. She's kind of the expert in this. And we kind of came up with an approach to diagnosing this in a shelter that would be most cost effective. And so you actually want to start with a wet mount with this, and that's why I was saying that Charity has kind of a floating leaf motility. For this, they kind of dart. And so if you can get it on your wet mount, great, you've got your diagnosis. However, if you're in a shelter and you've had a hoarding case come in and you have all of these cats and some of them are symptomatic and some of them aren't, and you really need to find out what's going on with these guys, and you have limited resources for addressing this, this is a good protocol to kind of step-by-step go through. So you've done your wet mount. If that's negative, then you go on to a fecal culture. And what you can do for your wet mount is, if the cat is having normal feces, you can either try to induce diarrhea by giving them some lactulose. It seems like just the giving them some diarrhea may make those guys a little more apparent. You can also do a saline flush anally to get, rectally, in order to get the sample that way. So like flush just 10 mils of saline in, using a kind of a red tipped catheter, and then pull it back out gently, and then just put a couple. If you don't see anything on your wet mount, then you can use a portion of that sample to put into your fecal culture, and then reserve the rest to hold aside and maybe centrifuge down and pellet, so that if your fecal culture is also negative, but you have a really high degree of suspicion, you can submit that pellet for PCR testing. You can also submit just straight feces for PCR testing if you decide to go that route. So the treatment for this particular organism is ranitazole. The problem with this drug, unfortunately, is that it can have, it has a pretty narrow margin of safety, and it can cause neurological signs. It's similar to metronidazole in that sense. It can cause neurological signs, and so unfortunately that's reversible. If they're on the drug and they do have an adverse reaction, you can stop giving them the ranitazole, and the symptoms will reverse. It's 30 milligrams per kilogram orally, and this is really important where there's been some folks that have kind of gone, well, I'll just have this compounded, and it'll go into a capsule, and I'll just have capsules of this size, and I'll just give it to all the cats. That's really not effective. That's going to increase your risk that you're going to have either an ineffective dose, it's going to be too low, or you're going to have a toxic dose that's going to be too high, and the cats are going to get neurological signs. So what you want to do is really have them compounded specifically for the cat that you're treating, and you do need to put it in the capsule form. The liquid is really bitter. They hate it. There's really no way to mask that taste. And there's been some folks that have done a paste in the ear. That's not good either because that can expose people, and then we can get exposed to that, and that's not good either. So it really is important that you have it compounded specifically for the weight of that cat. Okay, so further considerations. I only have, I think, 3 more slides to go, so I can hurry up. Retesting is not necessary. Again, if you, it may be necessary, however, if you still have the symptoms on this animal. But again, you may need to broaden your net if you are, treating for one thing and you're not getting resolution. Okay, we'll have our summary. So basically, I mean, these guys can be very challenging when you get them in your shelter. The most important thing is just minimize infection in the environment. Just get the feces up as quickly as you can. Change those boxes if you can twice a day, minimum once a day. And you have the doses in your notes if you need them. And I'm available for other questions if you want. And I just lastly would like to thank Maddie's for making this kind of research possible, making my position possible, and making this conference possible.